Obsessive-compulsive disorder. Obsessive-compulsive disorder, OCD, is characterized by a pattern of unwanted thoughts and fears, obsessions, which cause you to engage in repetitive behaviors, compulsions. These obsessions and compulsions disrupt daily life and cause significant distress. You can try to ignore or stop your obsessions, but doing so will only make your distress and anxiety worse. Finally, you feel compelled to engage in compulsive behavior in order to alleviate your stress. Despite efforts to ignore or eliminate bothersome thoughts or urges, they return. This results in more ritualistic behavior, the OCD vicious cycle. OCD frequently revolves around specific themes, such as an excessive fear of being contaminated by germs. To alleviate your contamination fears, you may wash your hands obsessively until they are sore and chapped. If you have OCD, you may feel ashamed and embarrassed about it, but treatment is available. Symptoms. Obsessions and compulsions are common symptoms of obsessive-compulsive disorder. However, it is possible to have only obsession or only compulsion symptoms. You may or may not realize that your obsessions and compulsions are excessive or unreasonable, but they consume a significant amount of your time and interfere with your daily routine as well as social, school, or work functioning. Obsession symptoms. OCD obsessions are intrusive, repeated, and unwanted thoughts, urges, or images that cause distress or anxiety. You could try to ignore them or eliminate them by engaging in a compulsive behavior or ritual. These obsessions usually interfere with your ability to think or do other things. Obsessions often have themes to them, such as fear of contamination or dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control and harming yourself or others, unwanted thoughts, including aggression, or sexual or religious subjects. Obsession signs and symptoms include the following: fear of becoming contaminated by touching objects that have been touched by others. You're not sure if you've locked the door or turned off the stove. When objects aren't neatly arranged or facing the right way, it causes a lot of stress. Images of crashing your car into a crowd. Thoughts of yelling obscenities or acting inappropriately in public. Disturbing sexual images. Compulsion symptoms. Compulsions associated with OCD are repetitive behaviors that you feel compelled to perform. These repetitive behaviors or mental acts are intended to alleviate anxiety caused by your obsessions or to prevent something negative from happening. Compulsions, on the other hand, provide no pleasure and may only provide temporary relief from anxiety. When you have obsessive thoughts, you can make up rules or rituals to help control your anxiety. These compulsions are excessive and frequently unrelated to the problem they are meant to solve. As with obsessions, compulsions typically have themes, such as washing and cleaning, checking, counting, orderliness, following a strict routine, demanding reassurance. Examples of compulsion signs and symptoms include hand washing until your skin becomes raw, checking doors repeatedly to make sure they're locked, checking the stove repeatedly to make sure it's off, counting in certain patterns, silently repeating a prayer, word or phrase, arranging your canned goods to face the same way.